Hey everyone, welcome to the Mental Health Mukbang, where we make mental health easily digestible. I'm Christopher Vo. I'm an MFT from Houston, Texas. I've got my trusty Europlate, and we're going to be talking about therapy from a therapist perspective.
My name's Jed. I'm a therapist out of LA, and I've got a bowl of shin ramen and kimchi and spam.
I'm Jeanie, a clinical psychologist from Houston, Texas, and I have ramen with broccoli and egg from a Sun Noodle pack.
Cool. I'm Jeanie Chang, LMFT from Raleigh, North Carolina. And my kids went out, did some errands, and decided they were going to pick up some Taco Bell. So I said, pick me up some because I'm filming this. And so I have a Taco Bell soft taco. Yum, healthy.
Is it? Is it though?
I had birria tacos for the first time last week, and they are indeed life-changing. They live up to the hype.
Which kind of taco?
Birria tacos, have you seen those? It's
What
like
are those?
tacos that they make like a consomme, like a stew out of, and then they you dip it into it, and then they serve noodles and make it into a ramen. It's terrible for you, but it is amazing.
It sounds terrible for you.
Okay.
Not the best, but we love ramen.
Yeah. So a common theme in Subtle Asian mental health is people don't know what it's like mental health conversations. These are the first times they're ever having it, right? So what was your first therapy session like for everyone? What was that like? Jed?
Am I starting? Cool.
Yeah.
So I actually didn't start therapy until, well, I really didn't even think about going to therapy. I had always thought about becoming like a counselor or therapist, but I hadn't actually gone to therapy myself until I was required to in grad school. And I think I was fortunate because my first experiences with therapy were great. I saw two different therapists. So I was in grad school. I was like, I'm gonna be ambitious Asian person and be like, all right, I'm gonna do. They only require you to see one therapist. I want to see two therapists so I can get a better idea of what's going on. So I ended up seeing two therapists. One Asian female who was like psychoanalytic, and then one Asian male who was more like, I don't really know what his theoretical orientation was. I think it was like CBT, but I'm not 100% sure. It was very systematic, and he was kind of like he's like a notebook guy. So he's got the notebook out, he's taking notes, and you're like, okay.
Old school style therapy.
What's that?
Old school style therapy. With
yeah.
writing.
And then my other therapist, the female, was she was psychoanalytic, and I actually enjoyed, despite me being like a cerebral person, I actually enjoyed psychoanalytic therapy because it was so I got to like say a lot of things and like express a lot of things. She was able to get that out of me, and it usually doesn't happen, right? Because in my head everything is like a thought process. But yeah, just kind of getting things out there was an interesting experience. I personally really enjoyed it. I connected with her more than I did the guy, but I definitely connected, I think, well enough with both of them to be able to kind of get into some stuff. Obviously, it wasn't going to be like super long term because I was a grad school student and I was broke and I was paying out of pocket. So, but yeah, it was a good experience for me, and I definitely thoroughly enjoyed that processing piece of it. So,
What about for you, Jenny?
So I saw a therapist for the first time when I was in graduate school, and my husband and I were newly married, but then spending long distance. He was in North Carolina, I was in Texas. And so it was a really stressful time of my life. I was defending my dissertation, finishing up internship, all of that. And so I decided to see a therapist. He was a white male therapist. And I found it to be extremely powerful. I thought that it was, we talked about things that I did not expect to talk about. And yet they had connections with current day, which I thought was really interesting. And it was really eye-opening as a first experience in therapy. He was also psychoanalytic in training, but provided just a really interesting way to think about my life. And it was also interesting that he was a male, because I think that experience was really different than later when I saw a white female therapist. And that was when I was opening up my private practice after a season of being a mom. And so just trying to figure out my identity and what it looked like to be a working mom again and balance all these different aspects of who I was. And both times were really positive. And I'm still seeing her. But I do also wonder what it's like to see somebody who looks like me. And that's been on my mind recently too. But there are not a ton of mental health folks in our area that are older than me who are also Asian mental health professionals. So I'm still working on that, but overall they've been positive.
You can always come to California, where we have a plethora of Asian therapists.
Plethora in California. Yeah, I have the same problem here in Raleigh, North Carolina. I would love to have fellow Asian American therapists mentoring me too. You know, they're not around here. But I was going to say my first experience wasn't great, but it wasn't terrible, and it wasn't meant to be formal therapy, but it was premarital and marital counseling. Required by our church, but I went into it like I really wanted to do it. My husband too, but we really wanted to get things out of it, and I felt it was much more. What it turned out to be was an enriching Bible study. Nothing wrong with that, but I wanted counseling and I wanted guidance, and I don't think I got that at all. And so it wasn't a bad experience. I was like, well, let's just stop. I don't really see the benefit, which is why I think some people stop when they don't find the benefit. But then years later, just like Jed, when I was in graduate school, and I really felt like, and let me say this, I probably could have used therapy through the years, especially of raising my young kids. But later on, when I was in graduate school, when I was required, as Jed said, and we called it personal growth therapists, but we had to see them for at least 10 sessions. I saw her well after I graduated. I bonded right away. Like I felt the connection right away. She was white female, maybe 10 years older than me and 10 years older than me in career. But I loved I'll be honest, first time having all that time to talk about myself. and she was probably psychoanalytic too, because it took me back years and talk about just upbringing. And despite her very different upbringing, white, and it's clear because she would ask me a lot of questions, go, oh, you brought this up a lot about being perfectionism and all this stuff. Explain that to me. I think the way she did it was very well done. She asked me the questions. It wasn't ignorant. It was more like she wanted to delve deeper. And we talk about that now because we're trying to find culturally competent therapists, right? But I felt like she obviously she was able to connect with me well enough that I didn't take that as ignorance at all. And she wanted to delve deeper into my life and understand my culture. So anyways, I enjoyed it. And then she ended up graduating and starting her own private practice out of state. So that's technically why I stopped, but I would have kept going. And then I got busy, but good experience the second time around.
Yeah.
What about you, Chris?
For me, I've had 3 different therapists so far. The first experience was when I was like 15, 16. That was a family therapist. I wanted to go. My family went, and she was a very much older white woman, and we just didn't connect. She was very much that old school style of therapy where she talked down to me. She didn't really connect with me, and she wasn't culturally competent. She was giving advice that just wouldn't fly for our family, right? So I was kind of turned off to the therapeutic process, and that's kind of what made me want to be a therapist, actually, was because I wanted to get to make sure no one else had that same experience, right? In grad school, I had the same growth therapist, worked a lot through like implicit biases, and that was really helpful. And then the third experience was when I worked at juvie, and it was just dealing with so much trauma constantly. I needed someone to vent to. And those last 2 were much more successful for me.
That's cool. So as you can see, we also have our own experiences of therapy as we're talking about this. How about, and we talked about this earlier, the therapeutic alliance. What does that mean? And you heard me say it, and we've all said about connecting with our therapists, what that's like. What does it mean to really connect with your client? And we call it the therapeutic alliance.
Therapy term for the day.
I think therapeutic alliance is something that we talk about a lot. For me, it's it boils down to trust and empathy, right? If from a therapist perspective, it's, am I reading the emotions right? Is the client, can I tell that the client feels safe and vulnerable enough to talk about difficult topics? Are they engaged in the conversation as well, right? And you know, we talked about a couple of different therapeutic styles when it comes to like CBT, psychoanalytic, and things like that. Although that's really important, you know, I've read a lot of studies that say the therapeutic alliance is 70% of what makes therapy successful, right?
Yeah.
Yeah, I think. Oh, sorry. I think for me as like a client, you know, we talk about the structure of therapy, right? And so is this person consistent, reliable, communicates well, right? Those are the basic things. If your therapist is flaking on you all the time, not a good sign, right? And so I look at those things as a client first, right? Do they respond to emails at an appropriate time? Do they reach out when you contact them in an appropriate amount of time? That's all kind of the frame, right, of therapy, like the structure. But then relationally, I'm looking at, you know, are they responsive, right? If I'm talking about a hard topic and I'm starting to get emotional, do they reach for the tissue box? Do they note the emotion and express a sense of compassion or empathy in those moments? Can they reach me where I am in that painful place? As a therapist, you know, I feel when we have an alliance, I see it when, you know, sometimes clients, even in the first session, are telling you about really painful things, and you've just met them 15 minutes ago. To me, that feels as though we've created a space of safety, like Chris said, a space where people can be vulnerable and authentic. And so, you know, I feel that when we're, it's kind of like a dance, right? You can feel the movement of your time together and your language, and it feels like you're in flow together. And that's when I know, like, we are onto something.
I love that, the dance metaphor.
What about for you, Jeanie? Seeing as how Jed just took a giant bite of food.
I don't ever see you guys taking bites of food.
I was watching Jed take a big bite. Yeah, therapeutic alliance. You're right. It is I think a huge indicator. I mean, I love to see change in my client's life. So how I tend to define the therapeutic alliance is a couple ways. I do work with a lot of teens, young population. I will say they're a difficult bunch. You know, they're in that stage, right? So, and most of the time they're dragged in. So Chris, the fact that you wanted to go to therapy is refreshing to hear, but let's say most of the time the mom or dad drags them in and they're glaring at me. I've learned over the years never to take anything personally, and I'll try to connect with them by noting something they're wearing or literally something they said about, yeah, when I was in basketball the other day, then I'll be like, oh, so you play basketball, you know? And I think that's why I feel like I understand all the social media outlets like Snapchat and TikTok, because I have to talk that language. So I connect with teens by knowing what they're doing. I don't need to know everything, but knowing at least the social media stuff and people that they may like, the kicks they're wearing. When I say, are they Air Jordans? So I have to study a little bit. So that's my way of connecting, but sometimes that doesn't come right away. So I have learned over the years that the first session, depending on the population you're working with, can be tricky. And it's not until 3 or 4 sessions in where I'm like, I know, just like Jenny said, he or she trusts me, because they'll not stop talking. It's nonstop. You're like, oh, after like 4 times, I'm like, you know, I'm going to stop you because that's awesome. I love hearing all this, but let's talk about what we're going to do and blah, blah, blah. And that's great. But in my head, I'm like, I made a breakthrough. And it just feels good, right? That finally this person's trusts me to tell me everything that's going on, bad and good. And then the other part that I like to define therapeutic alliance is when I feel like I see change happening, where they come in almost can't wait to see me, or they're saying, okay, I couldn't wait to tell you this, but I did this and then this is what happened. I'm so glad. It just made me realize, wow, they trust the things that we're talking about. They're taking it to heart past the session and implementing them. And I just want to see that change in the client's life. So that's another way I feel like I'm connecting with them. Yeah.
I think for me,
That's
like,
true.
I think for me, like Jenny was saying, that role that you kind of get, there's a place where you, when you connect with a client, there's a place where you kind of realize that, oh, you know, this is going well, right? It's when they feel comfortable enough to just talk and talk, and you look at the clock and you're just like, oh, we might be going a little bit over this week. I think those are good signs that there's something happening there. And I mean, obviously boundaries are important, right? We try to keep it to what the limits are in terms of like how long a session's supposed to be. But when you know that you're getting somewhere in the conversation and that they're taking you into their life, I think that's usually a good sign that there's a pretty strong therapeutic alliance there. And I think for me, that's one of those things that I notice. And I spend a lot of time at the very beginning. Like the first session is always me just trying to get to know them as a person. You can kind of just, I guess you could say that it's kind of like speed dating, in the fact that you're just trying to collect all this information, right? The first session is, the first phase of therapy is usually just information gathering, trying to figure out what's going on. And so part of it is like, in this 1 hour, how much information can I get from them that will like help me to frame their existence for me in therapy. And I think that's where you draw a lot of that connection, right? You talk about the things that are easy to talk about, the things that they like, the things that they enjoy. You touch a little bit on like, oh, what's bothering you and why you decided to come in. And then you kind of like build that, oh, you know, it's easy to talk to this person into that relationship. And as it kind of, and if you can connect in like those first few sessions on those things, usually the rest of therapy goes pretty well. But it just kind of, that's where it needs to be, right? So I guess if I had asked you guys, like, what is, like, how can you tell that you're developing that connection? Not just like establishing therapeutic alliance, but like the process of meeting a client, right? What does that look like for you? Right? Because a lot of us do phone screeners or whatever, right? I don't prefer them. I prefer to do an in-person screening, but you know, it's not always possible, right? So how does that first interaction usually look?
Great question. Jenny?
Yeah, for me, in my practice, I offer a free 15 to 20 minute phone screen or a consultation. And I do that primarily just time, you know, like I don't have time to meet with people face to face, this before COVID, but you know, to see them, but I do have time to talk to them by phone. And so, but for me, that first contact is everything, you know, and I tell them that on the phone too. I say, how does this feel? Right? Even at that first phone call, I say, how do you feel about, you know, this relationship already? How do you feel? And they'll say, yeah, it feels good. Or, you know, I've never had somebody say it doesn't feel good, but like if they didn't, then I feel like we could both sense that. Yeah. And so I really, in that first call, and I get a lot of clients who are new to therapy entirely, I am like dispelling every myth that I can. There's no stupid questions. Ask me anything. I will provide any information that you feel like is necessary to decide if this is for you. Because I feel like it's our job to represent our field well, because it's been so poorly represented in the past. And so even if I don't take them on as a client, I try my best to ensure that it is a positive experience and that they know that that exists. So if the next therapist they call is not awesome and great and kind and thoughtful, then they maybe know, oh, well, that's unusual, right? That maybe I shouldn't be with that person. Or if the next person is all those things and amazing, then maybe that's a good feeling, right? And so that first phone screen is really, so my hit rate, if we get on the phone and, you know, all the different things coincide, right? Financially, time, scheduling, all of that, then it's pretty high that they will end up being my client, you know, because I feel like that phone call is a really great way to screen and get a sense of the fit.
That's awesome. I was going to say, in my practice, I don't advertise that I give a phone call, But if they ask for one, I will do it. Or as Jed said, or Jed previously said that he liked in-person meetings. I do prefer also, but this is pre-COVID, and not everybody can just come in for 15, 20 minutes, just, and then make that time. So I will do it. But I was going to say one of the things that in the first initial appointment, when I'm getting to know the client, and this is hard, and this actually makes my life a little more difficult because we have to document, but I do not take any notes in the initial session, and actually in none of any of my sessions. I just have learned that I have a pretty good memory. And if I have to really pull out something, I always have a pad next to me or here at my desk. I'll have something, especially if I'm getting some lengthy psychiatric history when it involves psychotropic medication. I will say, I'm sorry, hold on one second. Let me just hold it out. I need to pull out my piece of paper. What were the medications you took previously or what you were on? But that's my way, because I have found my habit is if I'm taking notes, especially in class, I'll miss something. I know people take notes to gather the information, but especially when someone's in front of me, even via teletherapy, I need to give them 100% attention, and I actually retain information better that way. So I will never take any notes, but it makes my job harder because after they're done, I'm done. I'm like, okay, I have an hour to my next client. I have to take this lengthy history, and I'm like typing as much as I can, but that's okay. Because I've had friends going, oh, I just do it within that session. I'm like, you know what? That takes away from my connection because I know me and I just have to be 100% present like this. So I don't take any notes.
Yeah. For me, I do what Jenny does, where I do the probably 15-minute phone consult. That's twofold. One, that helps me build that therapeutic alliance with that client initially. Reduces the amount of time that I have to spend on an intake session. Lastly, it helps me let me know if I'm not a fit for a client, because that's okay too, right? I tell my clients that all the time, where it's, if we don't work out, there's nothing wrong with that. Let me know whatever's going on. That way I can try to refer you to someone that I feel would be a better fit, right? And there are just certain populations that I feel like I'm just not competent in.
Yeah.
And I think that brings up a good point, right? Like, I feel like any therapist who's worth their salt, I guess, is going to make that very apparent at the very beginning of therapy, right? Is that, hey, I might not be the therapist for you, and that's okay. I think that most therapists should have that attitude. Like, I cannot solve your problems necessarily, right? And if we don't have like this good fit, if you don't feel like we're connecting, right, it's totally okay just to like go and like not see me, right? I'm totally open to that, because we're looking out for the best for our clients, right? And the best thing for our client might not be to see us as a therapist, and that's okay, and I think part of the art of therapy is just being aware of that, just knowing when that's not like the ideal situation. And I mean, like, there are plenty of times where I'm sure all of us have had that experience. It's like, this is not really working, and there's like a good bit of just, it's not going anywhere. And for us as a therapist, we usually address that, right? I think most good therapists address like, hey, like, I noticed that this isn't working out, like something is like not working in this conversation that we're having, and this is not going anywhere. And I think it's good to ask those questions, and I think that if a therapist doesn't ask those questions and you are feeling something like that as a client, like, you should just be like, nope, I'm out of here, this therapist is just not the right one. And I think that is a journey, though. It is a struggle to find a therapist who fits, like Chris said, like, hey, like, sometimes you just find someone, you're just like, nope, this is not working for me, and you're just like, on to the next one.
Yeah, so true.
Yeah.
And
I know. I always.
Oh, go ahead, Jenny.
No, I was just gonna say, like, to follow up with what Jed said, I always ask the clients to trust their gut, because it doesn't lie. If you don't feel safe, if you don't feel heard, kind of in your stomach, and I think that encouraging people and giving people permission to listen to that can be really empowering for people.
Yeah, your gut's your second brain. You've heard
tells
that
you
term.
what you want to eat, right?
But that's why that's like, you have that gut instinct. You're right. I like that.
Yeah.
Chris, what were you going to say?
So for you as a therapist, then, how do you know that a client won't fit?
That's a good question.
Yeah.
I think it starts for me really basically areas of competency. Do I have the training, the background, the experience to work with them in their area? So I don't do eating disorders work, for example. I don't do couples work, and there's different areas or specialties that I just don't have experience in, like LGBTQ issues. I don't see clients, because I'm not the best person for that. And so that's the first screener. The next one is severity. If they are actively suicidal, I'm in private practice by myself. I don't have 24-hour call. So they might need another level of care that I'm not able to provide. So those are the kind of the most basic areas that I automatically will say, you know what, I'm not a good fit, and refer them elsewhere. So those are the first ones.
So sometimes they'll still come to you. Do you, I don't want to like to use the word advertise, but do you make that clear on your website that you don't do that, or it's not clear and they still call you?
Yeah. So we would figure that out during the phone consult. So sometimes when people will come and be like, oh, I want to work on these issues. And I'm like, oh, okay, well, that's great. But those are not areas that I specialize in. And so then I'll say, oh, let me send you, 3 or 4 referrals of people who do that. And so that just kind of saves time. Yeah. Because not everybody looks at your website, and
True. You're right.
your areas of service.
Right.
So, yeah. Mm-hmm.
And I was going to say, I know Chris loves the couples or works with the couples. I don't know if you love them, but I worked with a lot more couples. But because when we have marriage and family therapy in our licensed name, I'll get a lot of couples calls, but I have experience in couples. So my angle is I just don't take couples now. So I won't say it like that going, I don't like couples. No, I don't say it like that. But I'll be like, I don't work with couples. And they're like, but you're a marriage therapist. I'll get that occasionally. I'm going, yes, but I just have a big patient load or client load, because I still call them patients because I came from primary care, and I'll say I don't have space. But in my head, I'm like, yeah, I will refer you. But I'll always find people to refer to the couples. So that might be where I am actually okay with couples, but just don't want to take any more couples referrals. Sure. But you're right. I do make it clear. There's a couple times just people are suffering from things like depression, anxiety that clearly I can work with, but then I find out there is addiction. So most of the time usually I'll get an addiction case that comes up where they're more in the maintenance part of therapy, but still have that. So if I know they're not, the severity is they're in remission, or is it remission? Recovery. Then I actually say, I think that's great. You're wanting to see me for therapy to continue your progress, but I will say, who is your addiction specialist? Like, who else are you seeing? And if they don't, and a couple times I'm like, okay, I actually I need you to have that, because that is not my specialty. So if you relapse or should anything happen, I need to be able to refer to that person, then I get a consent. And I have a couple of those current cases, and it's fine as long as they have that addiction specialist, or they're going to AANA as well. So that's another angle to that. Well, that's not my specialty, but I still see them because we're working on other life issues.
Sure. What about for you, Jed?
So I work primarily with individuals and families. So it is a little bit different. There is a little bit of a different dynamic in that, because sometimes the parents will bring the kids in, and it's kind of like Jeannie's case where the kids are here, you're just like, meh, right? But I think there is like this. It's an interesting place to be sometimes when you find yourself between like a parent and a kid, and you're trying to make the parent feel like, I understand what you're saying, and then you're talking to the kid and you're kind of like, well, this doesn't sound like the kid has an issue, right? It's usually a relational issue when they bring their kids in, especially when I see like Asian, like immigrant parents and then like Asian American kids. It's always like some kind of relational issue. And I mean, from time to time, it is like the kid actually has like maybe depression or anxiety, right? Or something more serious. I usually don't see psychosis. But yeah, like when they come in and you realize that that's a relational piece and you have to redirect it to like a family systems approach as opposed to like a the parents come in with the expectation that you're going to fix the kid, right? But a lot of times that's not the case, right? Because the issue is that you're just not connecting as parent and child, and so it is interesting to see that dynamic play out sometimes. And I like to be in the middle of that. It's this struggle of validation on both sides, making sure that they both hear or are heard, and then helping them to hear each other. I think that's like the big thing with family therapy that I see a lot. And so yeah.
For me, it's one, if we just started to stagnate, right? I know there's something going on, especially if there's resistance. I'm more than willing to meet my clients where they are, but if there's consistent resistance towards change, then I have to question what's going on. Obviously, competence, clinical disorders, I typically don't work very heavily with. And then last, it's I have ran into this a few times where I'm starting to feel countertransference. Where they're starting, I can no longer be objective because they are making me emotionally aroused, right? And that typically occurs in like perpetrators of domestic violence, sexual abuse, things like that. They just evoke such strong emotions out of me that I can no longer work with them honestly as a therapist, right? Again, I can't stress that enough, how important that is as a therapist to know your limitations and be honest with that, and know, and not keep clients if you're not competent with them. Exactly. And then I think the last piece for this would be, how do you know when it's time for a client to discharge a client, when therapy has been quote unquote successful?
Celebrate now.
Throw a party. Actually, I did work at a place where when clients, we were working with children, but yeah, when clients would graduate from therapy, they would have like an actual party, and they would there would be like pizza and stuff like that, and so that was always a fun time.
Because it is a big deal, right? When you discharge, I like that. That's the word I tend to use. I actually say you're officially discharged. Well, first of all, I think it's a good feeling. I mean, there are times when clearly I have to be strong too, where I feel this connection with the client. You definitely, of course, have a connection with them. You've seen them grow, especially if it's about a year. And I've had some of those, and I will say, and they will slowly go, how about I see you in a month? I'll be like, okay, I'll see you in a month. All right, how about I see you next month? And then I'm like, when we're talking about shoes and pets, you know what I'm saying? I say that going, I think you're good. And I even use that word. I'm just very like, you are good. Like, I think you're really good. I'll have to be very enthusiastic. They just need that little push, and they know they're good. But it's just, I think they also want to make sure they stay good. And then so I'm just giving them the confidence. And I want to say, and I use the word discharge just because I think that was from my primary care days, that you're official. Here we go. You're officially discharged. Here's your discharge paper. No, I'm just kidding. I don't have discharge papers, but I make it a big deal and say that I'm always here. So they have that comfort, but I'm happy. And I joke and say, I'm happy not to see you. And I think they're happy too. But yeah, it's a big deal when we discharge them.
Yeah, I like to call it graduation. And I always say, like, you're graduating, and it's such a, if it's been a positive experience and there's been, forward growth. And, in my work with them in the very beginning, we define what the treatment goals are, right? And that can shift and that can change and they can add on and edit. But we are referencing those, throughout the work to say, hey, are you getting closer to that? And I feel like as mental health professionals, we have an ethical responsibility not to keep clients on, right, forever, because we're trying to foster autonomy, independence, confidence, empowerment. And so really, I tell my clients all the time, my goal for you is to one day leave me, right? Is to one day say, I got this and I'm ready, prepared with the skills and the knowledge and awareness to attack my life the way I want to on my own terms. And so it's always a time of celebration, and it's a time where, we know. And often we've already started tapering. We go from weekly to every other week to every 3 weeks or 4 weeks, monthly. And I love when clients are the ones that bring it up, because that tells me that they're comfortable enough with you to say, I think I'm ready to leave you, right? And they can set aside all the people pleasing and not wanting to hurt the therapist's feelings, and they can be advocates for themselves. And that's when I know you're ready. You're ready to face the world and have a voice and be an advocate for yourself. So that's how I know.
Yeah. No.
Yeah. I was like, where'd Chris go?
Yeah, we lost Chris.
We lost Chris just as we were wrapping up.
I'm sure he'll be back.
Okay.
Let's hope that he gets back so that he can also wrap up with us. But I guess from my own perspective, when it comes to discharge or when it comes to closing out, I do enjoy having that moment of closure, of being able to be like, hey, like, look at all we accomplished and look at how much like change we've been able to make from when you first came in to where we're at now. The funny thing though is that I do work with Asians, and so sometimes they're just like, they're feeling better and then they just kind of disappear. So I think that, I don't know if that's an experience that
I think that happens with all people though, not necessarily Asians.
When they're feeling good, yeah, they don't need therapy.
Yeah,
Yeah.
but you never really get to wrap up with them. They just kind of feel like, I'm feeling pretty good. And you call them, you're like, no, I think I'm good. It's like, oh, like, that's cool, I guess. Like, there's supposed to be like a formal termination process to this, but I guess if you're good, you're good. Which is nice to see, right? To hear that, hey, look, I'm doing good, and like therapy's, I don't think I need therapy anymore, right? And usually when that happens, they usually don't have to come back, and I'm fine with that, right? If they're doing good, they're doing good, and that is what it is. But as a therapist, I still don't appreciate being ghosted.
No, it's never fun.
Yeah.
No, of course not. Yeah.
So I definitely enjoy like the termination process and the review process of just like walking them back through, hey, like, look at all of the things that we've done to get to where we're at now. And I think that that's always I think it's beneficial for everybody, just for clients to be able to close out this chapter of therapy. It's like, I finished something in my life, and I think that that's like the capstone to treatment usually, right? Whether it's like depression or anxiety, it's like I accomplished something, I have control over something, or like my relationship is mended, or like my kid's not acting out anymore. Those the small things are what kind of make it work. And
But don't you love seeing their face? I mean, I do love seeing their face when there's the best word I can think of is they're hopeful. There's hope. Not like they didn't have it, and you saw it throughout the therapy process, but just at the end, the hope that they're good. I mean, that's the best word I can say. But it is a good feeling. So I mean, we're speaking to clients out there too that we've seen this, and it's exciting for us as therapists when we experience this change together and we are able to say farewell. Not because we haven't felt connected, but because we're so happy that you're good, So,
Yeah.
but I don't know if Chris is coming back. So this was the last question.
Yeah, I guess.
I do want to mention something, because we talked about the beginning and the end of therapy.
Yes,
But
that's
one
right.
thing I did want to mention is that therapy doesn't just exist in the hour that you see your therapist.
All right.
So when they give you homework assignments, or when they give you challenges and things to think about, or when they say, hey, when you encounter this situation, try to recall, right, our conversation about it. That is all part of therapy. Therapy is your whole week-long process. And so when people say, well, I showed up for my hour, I'm like, that's not enough, right? We need to be practicing those ideas and those skills and all of that throughout the week. So going to therapy is awesome, but it's week-long work throughout.
Totally. Yeah, I tell people this takes practice. I do have a line in my informed consent, that form that clients fill out when they first see me. The process is difficult at times, challenging. It won't feel good. It could be uncomfortable, but stick with it, and that's how we see change. And you're right. So I do say that a lot. It takes practice. And again, I try to do my best not to be like, did you do your homework? But I'll say that. They're like, what was it again? And I'll be like, seriously? And a couple of times I will say seriously, especially when I know them, and especially when they're teens. But I give homework. How about you, Jed? Do you give homework?
I do CBT. I always give homework.
You always
Yeah, I mean, I because that's just, first of all, it makes them think too throughout the week, and homework just means whatever they're working on. I feel like it's also accountability. Yeah. I mean, that's the best word, because you're right. The therapy is very much outside the therapy room for sure.
And that's definitely like part of it is buy-in, right?
The buy-in, yeah.
But I think that this discussion is going to head into a place where we're going to need a part 2.
Yeah.
So
for sure.
Yeah, no, for sure. Like part 2, we can talk about like the whole like process, and we can go more in depth into like what that looks like and challenges that'll come up. But I think this is a good place to end for this week.
Yeah.
And then next week we'll definitely pick up at part 2.
Talk about the therapy process for clients.
Yeah, the therapy process for clients. And so yeah, hopefully we will see you all next week when you join us for that. And every Friday after that, hopefully. But we'll see how it goes.
Oh, but before we say goodbye, we think Chris is joining us again, so we can say goodbye with him. But yay! All right. So, Chris, we were just wrapping up, but we're glad that you're joined us.
Oh, he's not quite connected yet.
You're not quite connected, though. It's okay.
Hear me? There we go.
Yes, there we go.
We can hear you. Do you
We were
have
just
final
saying our
thoughts?
goodbyes.
Yeah.
Oh, well, that works. Join us next week, guys.
Next week when we talk more about client therapy process.
All right. See you all next week.